Nitroglycerin is used to treat chest pain. There are other therapeutic uses such as acute heart attack, high blood pressure, emergency pulmonary edema, and heart failure.
Now that I'm taking nitroglycerin, I don't have to worry about my onset chest pain.
The sublingual route is placed under the tongue in 0.4 milligram tablets. Repeat every 5 minutes up to 3 times as needed. Do not exceed more than 3 tablets in over 15 minutes.
It's as easy as popping a pill into your tongue and letting it dissolve. If the first one doesn't work, I can take up to 3 in 15 minutes.
Side effects may include headache, nausea, vomiting, low blood pressure, dry mouth, weakness, sweating, dizziness, blurred vision, tingling in hands or feet. Call your doctor if you experience these adverse reactions: orthostatic hypotension, increased heart rate, slow heart rate. Do not take nitroglycerin if you are taking a beta blocker, calcium channel blocker, antihypertensive, and aspirin, and do not take it with alcohol. Call your doctor if you want to start nitroglycerin today.
So I heard you're having some chest pain. Can you explain that some more?
Yeah, so I was just sitting there playing with my fish, as one does, and I felt this pain, like right here area, but like it also like was like making my arm like really hurt, and like I couldn't feel it, and it was just kind of unbearable. So I called 911, and they rushed me to the hospital, and they said I could be having a heart attack. So I kind of started panicking. So they just admitted me, and I don't know what to do now. So
Well, scans show that it's not a heart attack. So I'm just gonna take a listen real fast.
okay.
So I'm gonna put you on a prescription for nitroglycerin, and
What's that?
It's just a little pill that dissolves under your tongue. It will help with your heart pain. My nurse will be in later to further explain that to you.
Oh, okay. Okay, thank you.
Oh,
Thank you.
okay, so the patient in 100 is getting a prescription for nitroglycerin.
Mhm.
Can you go and explain that to her?
Yes, I can do that.
Thank you. So patient 100. Hello, Lori. I'm your nurse. I'm Trenda. I want to be teaching you about the medication that the doctor just put you on.
Oh, okay. Was that
Nitroglycerin.
Okay.
So you have angina, which is chest pain. That's what you came here for. And the doctor wanted you to go on nitroglycerin, which is an anti-anginal to help your chest pain. So, nitroglycerin, basically what this medication does is it's used as needed. So it's not like a prescription or anything. You use it as needed at the onset of chest pain, and it will like widen and relax your blood vessels so the blood can flow more easy to the heart, and then your heart doesn't have to work as hard and it doesn't need as much oxygen, so then your chest pain is reduced. Okay? Do you have any questions about that?
No, I don't think so.
Okay. So it is mainly used to treat chest pain. It can treat these other heart disorders, but you don't have any of these, so right now you're just using it for chest pain. The doctor puts you on sublingual 0.4 milligram tablets.
What does that mean?
Okay, so sublingual means it goes under the tongue.
Under the tongue?
So like you lift your tongue and you just pop it right under the tongue, and that's how these work. This is what you're going to be on whenever you have chest pain.
Okay, so I just put it directly on my tongue, and then do I chew it or?
Oh, you just let it dissolve. So you're going to put it under your tongue, you're going to let it dissolve. You might feel like a burning or tingling sensation.
Okay.
But that is normal. That is letting you know that the drug works, okay?
Okay.
So don't be alarmed if you feel that sensation. That's how it works. So you can take this at the onset of chest pain. You take 1 tablet, and then if the chest pain is not resolved, you have to wait 5 minutes, and then you can take another one.
Okay.
And then you can wait 5 more minutes if it's still not resolved and take another one.
Okay.
You can't take more than 3 within 15 minutes, okay?
Okay, so I have chest pain.
Mm-hmm.
I pop one under my tongue.
Yes.
And then I wait 5 minutes, and if my chest pain's still hurting, I take another one.
Yes.
And then if it still hurts, I can take another one after 5 minutes,
Yes.
but I can't take more than 3.
No more than 3 in 15 minutes. And
So-
if you're still having that chest pain,
Okay.
right then you need to call 911, go to the emergency room. Something else is happening, could be a heart attack, and we don't want it to get there. Side effects. You might feel with this drug, you might get a headache. Headache is like the number one thing that you might get with nitroglycerin. Acetaminophen, like Tylenol, isn't contraindicated in any of your other drugs, which I checked your medical record and it's not. Acetaminophen can be taken to relieve that headache. It usually takes about 30 minutes. So don't be alarmed by that headache. And then you may experience some nausea or vomiting, dry mouth or weakness, sweating, blurred vision. You might get like a tingling sensation in your hands or feet. Like, don't be alarmed by these side effects. This drug is going to lower your blood pressure though, okay?
Okay.
Just make sure you keep up with your blood pressure at home and then your heart rate and stuff. If it gets too low, you're not going to want to take this drug.
Okay.
There are other reactions that you might need to call the doctor for.
Okay.
So if you're experiencing, if your chest pain is not relieved, like I said, whenever you take this, come to the hospital. We'll talk with your healthcare provider. While you're on this drug and you're taking it as needed and it's working, if your chest pain attacks are becoming more often, or if they last longer or they become more severe, anytime while you're on this drug, you do need to contact your healthcare provider.
Okay.
And then, like I said, with those side effects, there are some that if they occur, you need to notify your healthcare provider immediately.
Which ones are those?
Okay, so that is like the difficulty breathing or swallowing, like if you can't breathe. If you have like blurred vision, like it's like really bad so you can't see or anything. If you get dry mouth. Also, you can take a few sips of water before administering this drug just to help it dissolve. So you don't want your mouth to be too dry when you take the drug. And then like the sweating, skin rash, or if you just get like this extreme pressure in your head that's just not going away.
Okay, so if I can't breathe, call my doctor.
Yes. So what are the other side effects that you should call your doctor?
Blurred vision.
Blurred vision, yes.
Dry mouth.
Dry mouth, yes. And that extreme pressure in your head, okay?
Okay.
And then if it's not being relieved, obviously the chest pain isn't being relieved and the medication isn't helping, call your doctor, okay?
Okay.
And then for drug interactions, nitroglycerin, like I said, it decreases your blood pressure. So any drugs that also decrease your blood pressure, you don't want to be taking those at the same time.
Okay.
Those are like the beta blockers, calcium channel blockers, antihypertensives. Like, I'll check your record, make sure you're not on any of those.
I'm not taking any.
Okay, you're not taking. Okay, that's good. So you'll need to consult your healthcare provider if they ever put you on that, because nitroglycerin can interact with those meds. And then alcohol. Do not ingest alcohol while on nitroglycerin because it can also lower your blood pressure.
Okay.
When you take nitroglycerin for the first time at home, or like just your first tablet, you want to make sure you're sitting down because this medication can cause dizziness. And it can cause orthostatic hypotension, which is basically a drop in blood pressure whenever you like sit or stand immediately.
Okay.
So,
so I need to sit down when I take it for the first time.
Yes.
But after that, I can be standing.
Yes.
Okay.
But just be cautious because it can lower your blood pressure and cause some like dizziness or weakness and stuff like that. So make sure you're sitting down and get up slowly from a standing or lying position just to avoid that. Also, do not abruptly discontinue this. It is as needed. But you don't want to abruptly discontinue because it can like increase your heart rate, and you don't want that happening either. Okay. Can you tell me what you remember about the sublingual administration? How you administer
So
this?
I put it under my tongue, and I can drink water before to help with dissolving. So I put it under my tongue, and I sit there and I let it dissolve.
Yes.
And then if my chest pain isn't relieved in 5 minutes, I can take another one. And then if it still isn't relieved, I can take another one in 5 minutes. But I can't exceed 3 in 15 minutes.
Yes. Okay. What sensation might you feel? You might feel.
I might feel tingling and burning.
Yes.
Yeah. And I'll have a headache.
Yes. Yes.
Okay.
But that is normal effects of this drug.
And I can take acetaminophen.
Yes, to relieve that headache. And it's very important that you do not chew, crush, or swallow this drug, okay?
Okay.
It just dissolves under your tongue, okay?
Okay.
It's not interacted with any food or anything, so you don't have to worry about that or anything. And like I said, contact your healthcare provider if you experience any of those
Okay.
dramatic side effects or if your chest pain isn't being relieved or anything.
Okay.
With the storage, it comes in this amber glass bottle like this with the
Okay.
seal cap lid, and you want to keep it in this glass bottle with the lid screw cap on because to protect it from the light and the moisture. So make sure you're keeping it in this bottle, keep it away from light, and just keep it stored in a cabinet or whatever. Keep it in here, and just to make sure that it's protected and that it's working. Okay.
All right.
So do you have any questions for me?
I don't think I do.
Okay. Well, if you have any questions, let me know. I'll be back shortly.
Thank
All
you.
right, thank you. Here's this pamphlet
Okay,
that I'll give you.
thank
Has
you.
any questions that you need?
Oh, this is gonna be wonderful. I'm gonna show
Awesome.
this to my husband.
Awesome. Okay. All right. I'll be back.
You
Thank
are wonderful.
You're
Thank
welcome.
you.
Thank you, Lori.
Thank you.